Good morning, everyone, and welcome to QE2 Foundation's Rise and Shine event. Thank you for joining us this morning so bright and early. I would like to acknowledge that we are in Mi'kma'ki, the traditional territory of the Mi'kmaq people. Acknowledging Mi'kmaq traditional territory is a way of showing respect for and honoring our shared treaty relationship. It is one of the many important steps we can take toward reconciliation. We are all treaty people. Just as a note to our guests online, I want you to know we are recording this event. We are hosting this wonderful gathering, virtually of course, to celebrate you, our communities of passionate champions who continues to support the QE2. We are also here to salute the healthcare heroes who have really kept us safe these last 15 plus months. And you're online this morning in the company of other foundation donors, board of directors, honorary trustees, Nova Scotia Health and QE2 leadership, physicians and staff, friends of the foundation and foundation staff. You're in good company. As you settle in with your coffee and listen to the words and stories shared here this morning, I hope you take pride in the incredible impact you have had at the QE2 and on patient lives across Nova Scotia. I'm pleased now to invite QE2 Foundation Board Chair Lydia Bugden to say a few words. Lydia.
Thank you, Susan, and good morning. This has been a remarkable year, hence our theme this morning of celebrating exceptional care in extraordinary times. We are so lucky to live here in a community and a province that cares so deeply. Thank you all for caring for the QE2. Your support has transformed health, transformed lives. I would like to extend a sincere thank you to our volunteer board of directors. It has been my pleasure to work with each of you this past year. I am in awe of your dedication and passion to all things QE2. I would also like to take a minute to welcome our new board chair, Bruce Towler, who will take the reins later this morning. I know Bruce will run a tight ship and continue on with the many successes of this great organization. And Susan, actually a formal welcome to you. This is the first time that you and I have had an opportunity to host an event, notwithstanding that you have you're coming on your first year anniversary with the foundation. I think that speaks to the type of year we've had. But I want to extend, on behalf of the entire board, our sincere thank you. You joined us last July in quarantine, jumped in with both feet, and have been leading us through these challenging times. Many thanks and welcome.
Thanks, Lydia. Yes, it is funny to imagine that today is when we're finally sharing a stage and hosting. But thank you also to the board of directors who has supported me through the year. It's been a remarkable journey, and while I haven't met as many of you as I would have liked over the course of the year, I can honestly say that the warm maritime welcome home has been really incredible. Amongst those who have welcomed me home includes the leadership of the QE2 Health Sciences Centre and our colleagues at Nova Scotia Health. One of those colleagues is Dr. Brendan Carr, President and CEO of Nova Scotia Health, and I would invite Dr. Carr to say a few words.
Thank you very much, Susan, and good morning, everybody. It's really a great pleasure to be here with you today, and kudos to the foundation for once again kind of hacking this whole COVID thing and figuring out how to bring people together to not let the circumstances define who we are and how we work and to not lose sight of the important mission that we share. So I'm really happy to be here. Just a few words. It's been a long kind of 14, 16, 18 months. I kind of forget now how long it's been. Some days I wake up and I feel like I feel like COVID has been like one of those mini-series on Netflix that I've been watching, and I wake up on Monday morning and I realize that I've been kind of doing nothing but watching the same show for the last 3 days, and I realize that I'm on season 12, and I don't even remember what season 1 was about anymore, but I'm still watching it because there's some promise that it's going to finish sometime soon. That's sometimes how COVID feels to me. So, and I don't think we're close to the end, but we are at an important turning point, and I think as a province we deserve to feel good about our performance and good about how we've been able to kind of protect our citizens, and we certainly need to focus now on kind of getting things going again, getting our economy going, and allowing people to be healthy through living kind of healthy, active lives. The pandemic has been a huge challenge to us as a health system, and really we've I think done well to a large extent because we've approached this as a huge team and as a partnership. And really, right from day one, like my earliest memories of the pandemic were when we were right at the beginning of phase one. We were trying to figure out, what we needed to do and how we were going to do that. We were calling out to partners, and the foundation, the QE2 Foundation, has been with us every step of the way. Whether it was immediately offering to buy pulse oximeters so that we could help to do monitoring of patients when they went home, buying iPads so that we could so that the patients in their rooms could communicate with their family members who weren't able to visit with them, supporting our mental health programs so that we could bring online virtual mental health programs that have treated thousands of people in this province in the last year and a half that didn't exist 2 years ago. Helping to fund over 40 research studies that have been conceptualized and initiated during this period of time that are all specifically focused on how we can do a better job of managing through COVID. We've done all of this with many partners, and the foundation has been really in the front row on all of that with us. And so I want to extend a huge a debt of gratitude and appreciation to the foundation, to everybody that supports the foundation for that work. I note our board chair, Janet Davison, is present, and I would offer our greetings on behalf of our board as well to say thank you. I guess the other thing I want to say is that, and we haven't just been doing COVID for the last 14 to 16 months. It has dominated our landscape. But I want you to know that we've actually, through COVID, have been, taking this opportunity to figure out how we can actually make this health system work better for people, and there have been incredible opportunities for us to advance things that we haven't been able to advance for many years. And again, we've done that, with the benefit of partnership with the foundation. We've been changing our structure. It's been a huge time of transition for Nova Scotia Health, not just in terms of leadership, but in terms of the way that we're organizing ourselves. And I would say that in a way, we're an organization that is kind of coming out of its shell. We've spent the last 5 or 6 years really just establishing ourselves as a single provincial entity. And I think our focus now is really on saying, how do we make sure that our structure is enabling the very best in terms of healthcare across this province, and really taking advantage of all the massive resources that we have across this province for innovation, and for really for just doing good work in healthcare. And at the same time, the foundation has been undergoing transition, and we've really been doing that together. And so I think going forward, really look forward to continuing to work with the foundation. I think that we've got a lot of exciting initiatives on the way. We're, everything from how we're looking at how we collectively address the needs of our vulnerable communities, of underrepresented populations, to exciting things like hybrid ORs and really the QE2 new generation site, which is a massive undertaking that will fundamentally change healthcare in this province, creates an opportunity for us to completely reimagine what healthcare should look like, and really I think helps to reestablish the QE2 Health Sciences Centre as a backbone for specialized care across our province and the region. And this is such an important mission for us to share together. And so I'm excited about that. I want to thank my fellow board members on the QE2 Foundation board, to all of the honorary trustees, to all of you, that are present today, who obviously care about this organization and the work that they do. There is a legacy here of the QE2, and I want you to know that legacy lives, and that I see such a bright future for us together in the years ahead. For those of you that are considering supporting the QE2 Foundation, I really would like you to know that we do not take that support for granted. We really cherish it, and our commitment is that we will work together as hard as we can to make sure that we translate every dollar and every thought, every good wish, every bit of energy that you provide to us. We will translate that into better care in the future here in Nova Scotia. So I think I'll stop there. I do want to say thank you to all the supporters. I want to say thank you in particular to Lydia Bugden, who's done a fantastic job as the chair. Lydia, it's been a pleasure working with you, and I'll also look forward to working with Bruce and the entire board in years to come. But again, thank you very much, and have a great day.
Thank you, Dr. Carr. That was lovely. We look forward to working together. You know, our work at the Foundation is really to inspire you, members of the community, to help us transform healthcare and to transform lives. And I think there's probably no better way to tell the story of impact to inspire others than by showing you pictures. And, the pictures speak 1,000 words. And over this past year, as Dr. Carr said, we haven't just been focused on COVID. And the impact of donations has been tremendous and has been felt across the organization. And I want to share the following video with you to tell you a little bit about your support. Hi, I'm Susan Mullen, President and CEO of the QE2 Foundation. What a year to come on board and work with each of you to improve healthcare. And though it was an unusual year, we have so much to be proud of. Community support for healthcare is stronger than ever. From health hero signs in windows to fundraisers for COVID-19 care, our communities rallied. Whether you donated money or time, participated in an event, or created your own fundraiser, thank you for being an ally of the QE2 and our healthcare teams. While most moments were celebrated virtually, we came together in person for one special event, Ride for Cancer. On October 3rd, more than 1,000 riders hit the road or trail, raising critical funds for cancer care. A safely executed and memorable day. Melanie Clark was one of them. In addition to being a rider, Mel is a proud ambassador and cancer survivor.
So my name's Mel Clark. I'm 37 years old. I'm a mom of 2 boys, and I'm a breast cancer survivor. I was diagnosed when I was breastfeeding my first child, so I was weaning him, and I noticed a lump in my breast. And 2 weeks after that, I was told I had cancer, and within a month, I was having my breast removed. I know what it's like to face physical pain. It's not that I handled it really well. I was devastated every single time there was a roadblock in front of me. What if I need chemo? What if I don't survive this? What if I have to go through treatment and I can't have children again? But I think what it did for me was show me that there's another side to it. Even if on that other side it looks completely different and I look completely different, there is another side, and you just start building again. I am really proud of anybody who goes through something so difficult and then puts themselves out there again. And I've found a whole community, of love and support, and it just feels like an accomplishment that we will have done together.
Funds raised through RIDE purchased critical equipment for the QE2's Cancer Centre. This year, the team broke new records, raising more than $1 million net, an incredible feat by an incredible community. And speaking of cancer technology, support from donors like you means the QE2 will soon be home to a best-in-the-world detection tool for neuroendocrine cancers. This diagnostic scanning technology will change lives and provide answers to patients, like Sharon Needham, who, 5 years into her diagnosis, is still waiting to hear she is cancer-free.
I was diagnosed with neuroendocrine cancer in 2015. I feel like I'm cancer-free, but I'd actually really like to know if I am. I think the general public that haven't had cancer can understand it best right now with COVID. If you get a headache or a sniffle or a sore throat, you panic and think, do I have COVID and should I go get tested? It can be like that with cancer. Every time you have a symptom, you're wondering, is it back? And being able to prove it's not is probably the biggest relief you can have. And having the right test for neuroendocrine cancer is really critical. For the last 5 years, we've used different methods that aren't 100% accurate. It's like looking at something through a foggy lens or looking at a patient with a clear 20/20 vision. And really, you want to see the small tumors before they become bigger so you can treat them and get rid of them.
Sharon's story reminds us that even in a pandemic, health journeys are ongoing and require attention and care. QE2 teams reorganized and stepped up to the plate this year, ensuring urgent procedures could continue while teams responded to the virus. From nurses to technologists, doctors, and support staff, interventional radiology is one of those teams. Thanks to generous donors, the QE2 opened brand new IR suites where minimally invasive procedures help people facing blood clots, stroke, tumors, and more.
Our goal in this project was to make things better for patients. We approached it from the patient perspective, and we took that feedback to heart, and we enlisted our entire team for ideas about how to design the space, how we can most efficiently use the space. And through this project, we've now created 4 interventional radiology suites, so we've doubled the number of rooms to do procedures in, and we've created an 11-space pre- and post-recovery area for patients to come and go from in order to have their procedures. With the help of the QE2 Foundation, we can equip that 3rd and 4th room to really increase the number of procedures that we can do, which will shorten the wait times in order to get in for an interventional radiology procedure, but also allow us to do more. And that's the kind of impact that these donations can have. One piece of equipment can benefit thousands of people.
We are reminded again that the QE2 is able to deliver the best care because donors invest. We also celebrated completion of our $8.1 million campaign for surgical robotics, potentially life-saving surgery delivered to hundreds of patients to date. Our donors also continue to invest in research. Perhaps most notably over the last year, the QE2 Foundation was part of a local movement to gather real-time evidence and conduct research in the fight against COVID-19. These are just a few of the amazing milestones we achieved together. Finally, I'd like to introduce you to 2 women who are representing the face of healthcare today and in the future. Both nurses, Miriam Worry is a new grad, and Aisha Yaffa is still studying at Dalhousie University. They each received a QE2 Foundation Diversity in Healthcare bursary. Here's what they had to say about what the award means to them.
Being able to be getting funds to help us, it makes me be able to devote more time to my studies so I can pass and do well and in turn be someone that can give back to the community.
It will allow me to focus more on my studies and will also let me know that I'm supported. And even the moments when I am feeling like, oh my goodness, I don't want to study for that exam, it's like, let me get to the end of this because I know that there are people who are counting on me and people that are looking forward to me getting to the end goal in the future.
I think one thing that's very important is that the people that we care for in the community be reflected in our care team. And I think that the QE2 is just honoring that and making sure that people in our community are reflected in our care team so that we can bring that unique perspective to them and get the best care.
Helping to fund education, research, technology, and patient comfort items, you continue to make a difference in the lives of every person who enters the QE2's doors. Patients from every corner of Nova Scotia and beyond have felt your support. Thank you. You are making incredible things happen, and it is noted, appreciated, and celebrated. What a year to look back on. An incredible year, and you were part of really helping to transform healthcare. So thank you to those of you in the audience at home in your breakfast table celebrating with us this morning. You know, all of the work that you saw in that video was happening, of course, in the backdrop of COVID-19. And that leads me to turn to a leader who has played a really important role in our province in helping to keep us safe through the course of COVID, and with a really particular emphasis and focus, I would say, on the importance of making COVID testing readily available. Dr. Lisa Barrett holds many titles. She's a clinician scientist and infectious diseases doctor at the QE2, the director of research for infectious disease with Nova Scotia Health, and an assistant professor of medicine and microbiology and immunology at DAL. She has handled many media inquiries on COVID, including national media, really, I think, showing the true leadership we have in this province. She was the recipient of a research grant from the Nova Scotia COVID-19 Health Research Coalition, of which the QE2 Foundation is a funding partner, thanks to people like you. And I have a few questions for Dr. Barrett to kick us off, but I encourage you, we will have a Q&A, and if you are sitting on a question that you want to ask Dr. Barrett, please type it into the chat function, and Tanya McLean, our moderator for that portion, will be monitoring and is monitoring the chat function. Thank you, Dr. Barrett, for joining us today. Let's jump right in and tell us a little bit about the research that was funded through the Health Coalition with respect to COVID. What's it about?
Sure. Well, thank you very much for having me here this morning. An absolute pleasure. And I just had the joy of going through and seeing that video as well. So thanks for letting me be here. And thanks to everyone at home who's gotten up early and is having their favorite cup of coffee at home. Mine arrived at my house after I left, so no coffee in me this morning. The research that was funded related to COVID-19 through this foundation really has been very timely and important specifically to Nova Scotians. In the first wave, remember back in the first wave, way back, there were no vaccines. Not only did we not get to choose, we didn't have any. We weren't certain what COVID-19 was and how it was all going to play out, but we did see very quickly that it was causing an incredible impact, and not in a good way, in our long-term care facilities. Part of the work I do is to understand immune systems and to start to unravel exactly what it is that makes your immune system not work as well as you get older. And in particular, we were very keen to understand what happened in long-term care facilities. And part of the work that's been funded through my lab and the QE2 Foundation is that we recruited people from long-term care facilities, those who had COVID, those who didn't, to look at how their immune systems responded, see who did really well, and then for those people who did really well or didn't do well at all, to learn what was about their immune system and their response to COVID-19, how they responded, if they responded, and were they able to survive? And I will say thank you very much. We've learned a lot even so far. People from the age of 56 right up to greater than 100 years old have been involved in this research, also doing it with Dr. Melissa Andrew and Ken Rockwood, integrating the idea of care. And you're all familiar with that as donors of the QE2 Foundation, because that's what you folks do, is care. Integrating care and not just basic science research into what makes an immune response successful. And we've learned that some people who were 102 didn't even know they had COVID. Their immune systems, when you look at them under a microscope, look like they're about 50 years old. And then you have people who were very young that we didn't expect to get very sick. Their immune systems looked older. And so the beginnings of all that research and those findings I've just mentioned are actually funded in part through QE2 Foundation donors. We're very grateful for that. And it is in part how we're going to look at older people and how they're going to continue to respond and be resilient, we hope, with vaccines over time. And that's a continuing piece of work. So really and truly contributing to care in real time, understanding what happens when people are exposed to something when they're older. And that's going to help us figure out how we're going to help people and care for them better as they get older from an immune perspective over time. So this research that the QE2 Foundation has helped fund extends far beyond just COVID. Your immune system as you get older is what keeps you going in many ways. And we've started to make some really important and seminal steps towards understanding that.
That's great. What does the research landscape look like in Nova Scotia now, and how has COVID either helped it or hindered it, perhaps?
Yes. So it's hard to be a human being in a pandemic, and I think we've all figured that part out for sure. It's really hard to be a researcher as well, and I don't just mean an infectious disease researcher or an immunology researcher. Really tough to get to your patients in oncology, in cardiology, if you can't come into your actual building and see patients and keep your clinical trials going and understand, in radiology, where are the people that we need to recruit, or how do we get our patients in safely into hospitals? So it's tough to do research. Nova Scotia had a lot of great things going on, synergies. The Nova Scotia Health Authority Research and Innovation Group with Dr. Gail Tomlin-Murphy and her staff worked very hard to bring research into the COVID pandemic and to try and keep things going. I will say one of the toughest parts, and not always, if you will, the sexiest part of research, is building the capacity to respond very quickly. That takes the building of core resources, of centers for rapid response research. And certainly we did really well in starting to develop those things in the pandemic, but we've also realized that as a health authority, as a group, as researchers in Nova Scotia, we need to invest more as we go along in building core resources for research. Not just the project, not just one research question, but the ability to respond quickly in times like this. And that's where we're heading next. And I think as we go forward, and foundations like the QE2 Foundation, who've been so important, I think that's going to be an important part of what we need to do as we go forward, is really start to build those core bits that allow us to respond quickly, not to be competitive. Someone said to me the other day, to be competitive for research dollars. And I said, no. To look after people like we did with this long-term care research. You need to be fast for people, not to be competitive. Although I hear that's important too, but this is about people and patients, and that's why we can do this here with the help of groups like the QE2 Foundation.
Thank you. Just switching gears a little bit, I introduced you and talked about your commitment and really your advocacy for testing. And one of the things that I've heard you talk about is this new front of the nose test. Tell us a little bit about what that is and what that will mean for our audience.
Oh, well, good news. I can leave some for you to try out later on. So as we move through, and again, this is research around the world and the country, we've realized we need better, easier, and faster tests for people. We want people to be able to, as we try and understand this virus, vaccines are amazing, but vaccines are the star player that needs help. There's got to be a team of prevention, and they need tools like testing because viruses mutate and change, and they move around without symptoms, even with vaccines. To keep all this under control, at least for a number of months, we need to get a testing plan. That takes innovation. That takes research and home tests. And one of the new things that's coming about now is a not so deep swab. And I'll turn sideways and say not so deep swab that really stays in the front of your nose. And because of that, you can do it yourself at home. It's very much, some of the versions are very much like a pregnancy test, and you just read the test yourself at home. And that's a huge difference. This is not a medical test anymore. It's like the way you maintain health and prevent disease by brushing your teeth every day. You also hopefully will be able to do more home testing. It's important to support our vaccines and stay ahead of things. So hopefully coming soon, Health Canada is looking to approve more of these tests, and we'll be looking for lots of people to try them out. So if you're sitting at home and thinking about your next project, helping out with home tests is on your list, I hope.
That's great. I look forward to trying them. My last question for you is really, I think the burning question. Our audience is at home. At some point, we hope to get back to a new normal. What will that look like as we expect the population, assuming the population gets the double vaccinations that we are planning?
Yeah, I think that's a great question. And crystal balls. Oh boy, I always polish them right before these talks, but sometimes they just get a little fuzzy. If there's one thing we've learned, and I think research has helped us here and learning has helped us, we still have a lot to learn. And I think what the next 6 months looks like is that we are still on an effort and a goal of getting people vaccinated. Until that happens, and we see how this virus in the real world over time interacts with the vaccines and us, as societies, as we start to open up, I think we're going to have to keep a really close eye on things. And what that means is this looks like lots of opening up, but lots of mindfulness, safer COVID living, right? So as opposed to back to the pre-COVID normal in the next 6 to 12 months, I see lots of movement, lots of doing. I hope lots of socialization because I'm getting really lonely at this point, and I'm sure so is everybody at home. But it's going to be slightly different. A little more mindfulness of some basic public health measures. Staying at home when you're sick sounds silly, but we've learned it works. What happened to common colds during COVID? What happened to flu? So that's going to happen. And also, we're going to see that people are going to need to look after each other in communities. And that means getting vaccinated and keeping up testing. So still movement, lots of light. I mean, I don't even think the light's at the end of a tunnel. We're in the light. We were on lockdown, and now we're moving. Slightly slower to New Brunswick, maybe, but we're getting there. Listen, compared with 4 weeks ago, we're in a totally different place. We're moving ahead, and we can always move ahead, and we're going to keep doing that if we stick together as a community. So that's what I see in the future, and one of the silver linings for me has been the community and the ability to promote research, learning, knowledge, and the use of that research, knowledge, and learning in the public sector so quickly. So that's what I see. I hope that continues.
That's great. Thank you. Thank you, Dr. Barrett. Tanya McLean has been monitoring the chat, and I'm going to turn it over to her for Q&A.
Okay, great.
Thanks, Susan. There are lots of great questions coming in for you, Dr. Barrett. We talked a little about what our new normal could look like with a high percentage of double-dose vaccines. But what do you think our action plan is if we don't reach that desired percentage?
Well, people tell me I have these rose-colored glasses, and they apparently don't come off because I think we're going to reach that target. We're going to get sciencey for a second. Hold on, but it's good science. If we don't reach that target, the words herd immunity get flipped around, and they can become a soundbite. Take it back a second. When you have partial immunity, the virus looks at you as Disneyland because you've got a little bit of immunity. But if you get exposed to a virus, what's going to happen is that virus is going to start to change and mutate more quickly. So in a population of people that only have one dose, you may keep hospitalizations down for a little bit. You may keep people from getting too sick for a bit. But eventually the virus will use that as a tool to get smarter in only partially vaccinated people. We need people to be fully vaccinated. So what does it look like if we're partially vaccinated? I don't make the policies, but if it were me, it wouldn't look a whole lot different because that's a bad idea for a partially vaccinated community to start moving amongst itself without a plan to be fully vaccinated. That's a way for the virus to escape and make our vaccines a little less star quality. So let's go for 95%. My tree can't come down. I've told people my tree can't come down until 75% of Canadians are vaccinated. Eligible Canadians are vaccinated. So I'm hoping that we're going to meet at least the 75% range.
For those who don't know, Dr. Barrett has a Christmas tree still up in her home.
I won't take it down until Canadians are vaccinated and we can do it. But it is getting a little old and my apartment's very small. So keep going on promoting vaccines with your family and friends, folks.
So another question is, if you are fully vaccinated, are you still vulnerable to the new strains of COVID?
Yeah, and vulnerable is a fun word. So we do know, at least in the UK, Germany, parts of Spain, where they have seen Delta variant virus, and that's the newest version. Delta's cousins are sitting in the wings, but Delta is the biggest one circulating in the world right now, that the current vaccines that we have in Canada licensed that we're using do provide excellent protection for people who have 2 doses, 2 weeks after you get your second dose at least, and out to, we're starting to see data come out for about 3, 4, 5 months. They do provide excellent protection. So are you vulnerable to hospitalization and death? Not nearly as much. These vaccines still work incredibly well against even the newest version of the virus. However, they don't completely prevent transmission. And if there are people in the community who are less immune, even after 2 doses, because they can't get more immune, they're very much older, they may have other medical conditions or immunosuppression, then those folks do remain somewhat vulnerable, which is why we all need to keep virus down by getting 2 doses, keeping virus in the community low, along with 2 doses of vaccine is our best way of not asking the question about one person being vulnerable. We should be asking about our communities, because that's the real answer in a pandemic.
And what do you think are the opportunities for rapid testing for, say, at a wedding or a concert or business gathering? Do you think the province will move to allowing this so that the gathering limits could be higher?
Oh boy, wouldn't that be fun? Yes, I would love to see that happen. There aren't a whole lot of reasons why not. We're heading into a summer, and hopefully there are some plans to start doing things at festivals or bigger gatherings if people go in. Because let's all be clear, again, the vaccines are superstars. And if we support them with testing, which is your proof principle as you walk through a door that you're neg for the day or negative, you don't have any virus that's infectious to other people for that day, your ability to be an exposure site or somewhere where you might infect other vulnerable people is pretty much close to zero if you combine vaccines and testing. And so that's an excellent question. Love to see rapid testing getting done, but not getting done to people. We've done so well in Nova Scotia, just the way the QE2 Foundation has done so well in Nova Scotia by contributing, by owning this. And I really hope that we move towards rapid tests being part of a person's way of approaching things, not being done to them by medical professionals. And that's where some of these new tests that Health Canada is starting to approve will come in. Do this yourself at home. It's your own personal tool of protection. Test to protect, and that power becomes back into the person, just like with vaccination. We own how we're going to respond to COVID-19 and this pandemic next, and rapid tests are a big part of that.
And when will we know if we need an annual COVID shot? What's the research telling us about that?
Boy, that's a great question, and does come back to my immunologic soul that I like to think about. This virus, so what respiratory viruses do over time, if this one follows all the other respiratory viruses that we know of, it gets more and more and more virulent or causative of disease for a while, usually a few years, and then it settles out into a new, slightly less virulent, common coldish version. Right now, COVID is far more virulent, meaning causes more disease, death, and impact than does the common cold. Let's all be clear, it's not reached that stage yet. So the virus is changing too fast yet for us to know how it's going to interact with this current set of vaccines. We need a few more months. We need to see how much the virus mutates, and then we'll know if we're going to need different vaccines over time or seasonally. What I do think I would bet my socks on, and I'm not wearing any this morning, so it's a safe bet, but COVID-19 is not going away. It will switch from what we call a pandemic to an endemic, one of the other circulating viruses. Number 2, it's going to be a while before we know if we need a booster shot. But number 3, the certain way to keep needing to get boosted is to not sequence the virus, not do enough testing when people have no symptoms, and to ignore the virus. And we don't want to do that in Nova Scotia, Canada, or internationally.
And what about the children in our province? Will we soon be vaccinating those under 12 here in Nova Scotia?
We are waiting on the studies on under 12 just to look at the safety data. I think there's very little question as to whether or not under 12-year-olds will be actually able to respond. As soon as there's Health Canada approval for people under 12, then that will become an option. Until then, they are folks who are susceptible. We thought at one point that kids didn't get the infection. It's not quite true. And we certainly don't know what the case is with the Delta variant. So we do need kids and their parents to consider getting vaccinated. Kids are humans. They have different cells and respiratory tracts that do get infected with this virus. And we know that kids are really good at getting respiratory viruses. It seems to be from 2 to 4 their main job sometimes. So yes, looking forward to getting vaccines for people under 12, need the data, need the information. That's coming soon, but it's not going to be in the next few months, which is another great reason for us to make sure we understand that we're not fully protected until everyone has an opportunity to get some vaccine.
And what science or data are we still missing right now in the fight against COVID?
We have learned a mountain. At the beginning of this, I took you to wave one. No information, weren't sure if we were going to make it through this, weren't sure what the death rates were going to be. We had no idea, no vaccines, and we were just barely getting the genetic code for this virus to know what it was. We've learned an incredible amount, but we still don't know how fast this virus is going to move, how it's going to move in different populations. Are there going to continue to be vulnerable subgroups of the population we need to protect somehow or differently? Are we going to need, at a care level, to change how we build hospitals? Are respiratory viruses going to be something we need to think about when we're making health systems and how we implement health interventions, health care? And so as we go forward, not only is COVID, do we have to learn a lot more about COVID itself? We can't cure this. We've used therapeutics here where the Nova Scotia Health Authority and government have helped us to put together a therapeutics trial that was just run through Wave 3. But we don't know the right answers, and those are not cures for COVID. So we have a lot more to learn about what to do when people get COVID, how to prevent them from getting COVID, and what to do after COVID. This is not just flu. There do seem to be a lot of people with long-term sequelae and impacts that we're going to have to learn about. All of those things impact our healthcare systems, and that's a huge part of what we have to learn. And I really don't want to leave this part alone. We need to look at our health systems. I know the QE2 Foundation has been very focused on looking at things that directly impact care. And we need to, as we go forward, make sure that we're including things like pandemic preparedness in our new plans for new hospitals, making sure there's the ability to protect every single patient in every single, hopefully individual room from an infectious disease perspective. And we can do that, but it's still something we need to learn about.
I think our guests are very excited about the rapid tests, and they're just wondering how sensitive are the rapid tests relative to the gold standard?
I should know that I'm coming to a foundation, I'm going to get the science questions. So they are effective. It depends what your question is. So if you're using this test as your sole diagnostic test, as you would, for example, a biopsy, wrong test. It's not quite sensitive enough. You do the PCR test that's done at the QE2 and Nova Scotia Health Authority. That's the test you need. The rapid tests, and the ones we used most frequently during this pandemic and will continue to use at least for some of, as we think about getting into more at-home settings, that test is slightly less sensitive. And what that means is about 7 to 8 out of 10 of every infection can get detected compared with 9.5 out of 10 with PCR. Slightly less sensitive, but our question really isn't in people without symptoms whether you have a disease that's going to make you sick in 5 hours. The question is there some community virus? And how much of it is out there? And the way we get around that slightly decreased sensitivity is that you test every week, because it's an easy test that you do at home. And if you do it every week, your rate of missing infections, because you repeat it, becomes much lower. And so all depends on the question, depends on the population. Great science question, but the answer is use the test in the right way, which is in no symptoms people, over time, repeatedly, once a week or every couple of weeks, is a great way of making the test just as useful and sensitive as other tests. And it's also very specific, meaning it doesn't pick up other viruses. It's very specific to COVID-19.
And here's a very timely question. The Atlantic bubble didn't quite kick off the way we thought it would. In your opinion, is Nova Scotia being a little too cautious?
So I have no idea about policy. I can talk to you about science and happy to do that. We have just come through a period of time where we had a wave 3. We were above 200 people, not cases, human beings that were sick in this province every day at its peak. We watched greater than 200, mid-200s of people come into hospital, and I've watched a good chunk of them get very sick and many of them die. So I would say that we've rolled back a lot of precautions in the last number of weeks very quickly, with some assertion that one dose of vaccine is a good thing, and we've been targeting lots of testing, knowing what Delta variant's doing and knowing how much virus is in our communities, along with trusting vaccines a bit. If we go too far too fast and stack up all of our unknowns and our bits of risk too fast, we run the risk of going backwards. And I can promise you what I do know is that, like last time in wave 3, when we had a set of virus that came in and it got around in the community, it took us a long time and a lot of effort to control that, and it took a lot of human spirit away. So do I think that this is too fast? I worry sometimes we're even going a little fast. I like to keep my 2-week intervals. Do I think this is too slow? I think that this was just another layer of extra unknown. We don't know how many people are going to come from other provinces unchecked into New Brunswick. We don't know how many people are exactly susceptible. We don't know how many people are just days from their first shot and therefore not really protected yet, despite the fact they count in the 75% number. And then adding that on to all the other change and lack of lockdown in 2 weeks would have meant yet another thing that PEI and Newfoundland decided was not reasonable either. We've all chosen to not have people come in from the other parts of Canada for a little while longer yet, except New Brunswick. So do I think it's overly cautious? From a science perspective, no, I don't. Do I feel very badly and very sincerely for people who had made plans and that this decision came at the last moment? And my hands are wringing because I do feel really bad for people. Do I think the science is wrong? No. Do I think that there's going to be a lot of these great decisions in the next little while? Yes. And will we probably choose to err a little bit on the side of caution when we're stacking up unknowns? Maybe. And we'll have to see if that works out for us, but I suspect it might.
And this is the last question that we'll have time for this morning.
Okay.
Are masks here to stay, or are we looking ahead to a time when masks become optional?
So many places in the world have bought in and used masks much more frequently than we have early on and even before the pandemic. I think we've got masks for a little while longer, particularly in inside situations, as we grapple with the changing characteristics of transmission of this virus and how easy inside it is to transmit, different types of ventilation in different buildings. We probably might be stuck for a little while yet, particularly in respiratory virus seasons. Does that make me happy? Just in case anyone thinks I love masks as an infectious disease doctor, I do not. They are not my favorite, but they are incredibly effective and protective for people. So for a little while longer, yes. In 2 years, do I think we're still all going to be wearing masks? Geez, I hope not. I hope our vaccine rates are up at take the tree down levels. The virus stays under control. We've kept it sequenced. We know what it looks like. It hasn't mutated too much because we've done lots of testing here in Canada, and that we'll get to a mask-free point. But it's going to take us a little bit in big settings, especially if we want to open up and be around lots of people. So we'll get there, but not quite yet.
That was wonderful, Dr. Barrett. Clearly, we could have these questions go on all morning. And on that note, for folks, if you didn't get your question answered, please do, if you've already typed it in, we've captured it. If you have questions as we go through the rest of the program, please type them in and we will do our best, perhaps even calling on Dr. Barrett to answer a few of those questions for you. Wonderful to have you here, and I feel like we're in good hands with this scientific and research leadership. So thank you very much, Dr. Barrett, for joining us.
Thank you.
Everything we do at the QE2 Foundation is in support of patients and families. 27-year-old Meg Keevel, recently had a life-saving experience at the QE2 following a health emergency that really no one saw coming. And Meg is here this morning to share a bit of her story with us. Thanks so much, Meg, for joining us. Appreciate it.
Yeah, of course.
You know, that day in March, and I make it sound like it was so long ago, that was 3 months ago, started out like any other day for you. Tell us a little bit about what happened that day.
Yeah, it was very different from any other day. It was Monday, March 15th, when I was working from home. I took a break to make some lunch, started to set up in the kitchen and felt my left leg going weak, and I collapsed. I tried kind of pulling myself up, but just kept falling over because I was losing feeling in my left arm and my face as well. Luckily, my partner, Mike, came home less than 5 minutes of this happening. He was just out taking the dog out, and he found me on the floor, immediately recognized what was going on, and called 911. The paramedics were there within 5 minutes. We live very close to the hospital. So they were incredible at, treating me on the spot and getting me to the hospital very quickly. I arrived at the QE2 probably within 15 minutes of this incident happening. So time was really on my side, and it was helpful to be so close to the hospital as well. The details when I arrived at the QE2 were obviously a bit foggy, but I was treated immediately. The team that met me when I arrived in the ambulance brought me to CT, where they found a clot in my brain and confirmed that I was having a stroke. They gave me TPA, which is a clot-busting drug, and I believe that was given to me within 28 minutes of me arriving at the hospital, which I've heard is record time for the QE2, so that's amazing. And then I was taken into surgery where the team removed the clot and essentially saved my life.
It's a remarkable story, and certainly talk about not knowing it was coming. And I know you have family members on this call this morning. What have they told you about those first 24, 48 hours? What was their experience of what you were going through?
Yeah, it was very scary. I think they all, were worried, but we had comfort in knowing that there was a really hardworking, talented team on my side trying to figure out what had happened to me. I've heard that, the care that I received from the beginning was awesome. The EMTs got to me very quickly and made a huge impact in my situation. The team in surgery was amazing, talking me through each step of the way. And I was also very lucky to have one of my friends, she's a nurse at the QE2, Lindsay. She was working at the time and was able to come be with me before I went into surgery and also when I came out of surgery, because of course, COVID times, you can't have anyone with you. So that was really helpful as well.
That's, when you think about the care, and we've talked a little bit about this, our audience heard a bit about the IR suites, the interventional radiology suites in that video that we played earlier. And some of your care happened in those IR suites. And donors help fund those suites. What does it mean to you when you think about that donor support being part of what helped you get to where you are today?
Mm-hmm. I'm immensely grateful for the donors and friends of the QE2 Foundation. I've obviously now experienced firsthand how important these donations are and know that they make a huge impact in saving lives. I'm also very lucky to live in Halifax, where this type of technology is available thanks to the donors. So thank you so much.
And Meg, you look well. How are you doing today, and what's next on your journey of recovery?
I'm doing really well, thank you. Since I was able to be treated so quickly and was in surgery, so fast as well, I was able to regain all feeling and movement on my left side almost within a couple hours of having the surgery. I did have kind of some left side neglect and a little bit of weakness for a few days, but that's all gone now as well. I'm still struggling a little bit with fatigue and concentration, but I'm working with my occupational therapist, Lindsay, who is helping me through that and also helping me get back to work. I was off work for about 2.5 months, but I'm now easing in kind of on a part-time basis, and it's going really well. And of course, during my stay at the QE2, I was there for about a week. They ran a ton of tests to figure out why I had a stroke. And it turns out I have a small hole in between the two chambers of my heart called a PFO. I couldn't tell you what that stands for, but that's what it is. So I'll have surgery at the end of the summer or early fall to close that hole, and that should be the end of it. So overall, I'm doing really well and slowly getting back to normal.
Wow. What a remarkable journey you've been on. Meg, thank you for sharing a very personal story with us. I appreciate that. And I think you're right. It does speak to creating an understanding of how important the technology and the tools being available is for the lives of people in our province. So, Meg, I want to thank you sincerely, and I want to wish you all the best as you continue your journey of recovery.
Welcome.
So that brings us nearly to the end of our morning together. Thank you for being with us and for your continued support. It really does mean the world to us. And with you by our side, we are committed to creating meaningful and measurable impact, whether for a patient in the hospital today or for preventing an illness tomorrow. We innovate, we are agents of change, and we lead with heart. The QE2 Foundation has big, bold plans to transform healthcare for patients from Atlantic Canada, which includes an exciting announcement that will come in September. I'm going to leave you with a bit of a teaser about what is to come, and I urge you all to stay well. Thank you.
What if we defied the view on healthcare? Disrupted, interrupted the status quo? What if we lean in and take our place on the global stage? We're loud and proud, unapologetic, relentless in our pursuit. This is our time to define the future of healthcare at the QE2. Uncomfortably exciting. On the cusp of something great. It's just the beginning. A QE2 revolution that is unstoppable, igniting a movement of what could be to what will be. We are all in. Just wait and see.